Hi everyone, it's Lisa Moeller with MedMark Media, and welcome to another great episode of DocTalk Dental. I'm super excited about our guest today. Dr. Duncan Brown is visiting with us all the way from the Great North, Calgary, Canada. Dr. Brown graduated from the University of Toronto in 1975 with a Doctor of Dental Surgery and became a specialist in orthodontics in 1978. Duncan's warm smile, sense of humor, and relaxed attitude are characteristics his patients and team all love about him. This is truly a doctor who loves his job and what he does. It's such an honor to welcome Dr. Duncan Brown to DocTalk Dental.
Thank you.
Welcome.
Thank you.
Thanks for joining us today.
It's an honor to be here. Thank you.
Coming all the way from Canada to warm Arizona in August.
Oh, there's nothing wrong with Arizona in August.
So, Dr. Brown, tell us about your orthodontic practice and how and when you got into orthodontics.
Well, I started in orthodontics in 1978. I moved to Calgary in 1979 and set up an office. We now have 3 practices. I have a partner, and we're doing pretty well.
I would say with 3 offices.
Yeah, it's busy.
That's amazing. So are you, what is your patient base? Is it kids and adults?
I do a lot of kids. About 50% of our practice is phase 1.
Mm-hmm.
The remainder of it, maybe 20% are adults and 30% are adolescents. We used to do a lot of pain management, but I don't do that anymore.
Oh, okay.
Don't
yeah,
like it.
That's no fun.
No, it's not fun. Not fun. And it's hard.
Yeah, oh yeah, definitely. And then I also heard that one of your patients now works for you?
Yeah, well, no, she doesn't work for me. We're real partners.
Oh, okay, she's one of your partners.
Dana and I are true partners. It's not common in our business. So she's one of my former patients, and she arrived 10 years ago, and she has been the gift from God.
Oh, that's
There
amazing.
hasn't been one sideways look in 10 years. Not
really?
one.
Wow.
She's great.
So tell us about your courses that you teach and give our audience a little bit of information about those.
I teach with a gentleman named Dr. Tom Pitts, who used to be involved with teaching with Ormco.
Mm-hmm.
And we now teach together both nationally and internationally on passive self-ligation. I also teach for Carestream, and I was teaching for Crest, Procter & Gamble.
Oh, interesting.
But not any, they don't need me anymore.
Oh, okay.
Which is good.
Well, your patients need you.
Thank you.
So that's where you need to be.
I hope so.
Yeah. So talking about Carestream, you use the CS 3600 intraoral scanner in your practice.
3 of them.
And 3 of them? Okay. So let's talk about those and why you chose Carestream and how important they are in your practice.
The choice for Carestream was really easy. We are a Carestream shop. I use OrthoTrack software. We use Carestream imaging systems, and the choice for a scanner was easy. As soon as they had one, we had a bunch of them.
Right.
We started off with a 3500. It was an okay machine, but it really wasn't designed for orthodontics. The 3600 is a wonderful machine.
Mm-hmm. And how would you say, like how so? How does it rate against the other competitors
Well,
out
we
there?
tried a number of others.
Mm-hmm.
We tried iTero. I tried one of the early versions of 3Shape, and they were much more difficult to use.
Really? So Carestream is definitely your choice.
Yeah.
Okay.
And it's fully integrated into the management system. It's a brainless exercise.
Right, absolutely. So how long have you been using those in your practice?
As soon as they came out, so I think we're on year 3 now.
Year 3, okay, year 3. But you've been using you had mentioned to me earlier about 30 years.
I had a 3500 or a number of 3500s for 2 or 3 years before this came out.
Isn't it so important with what you do in taking care of your patients to have the latest technology and imaging devices?
I have a different view of that.
Okay.
I used to be a bleeding edge guy. You wanted to be on the bleeding edge. The bleeding edge is a very expensive place to be. I now think you should use appropriate levels of technology. And there's no question that digital scanning is here, and it's here to stay. And I would encourage anyone to get into some sort of a digital scanner.
Absolutely. I feel these days, if you're going to a specialist and they don't have one,
Oh, you're really at a disadvantage.
yeah, you definitely need
Yeah.
to go somewhere else.
Absolutely at a disadvantage.
So we've talked a little bit about the importance of the technology in your practice. Let's talk about, how about some memorable cases recently where you've had outcomes with the CS 3600 and why you used it and how it worked?
The CS 3600 is a scanner. It's a very good scanner, but it's just a scanner. The real trick is what you do with it once you've got the STL file. And one of the things that I really admire about Carestream is that the STL file is open. You can actually get at it and import it into other softwares. And so we import it into third-party softwares, and we're doing amazing things with that. Everything from generating our own in-house aligners to generating mock-ups for digital smile design. It's a wonderful piece of equipment.
That's awesome. So it's really changed your whole workflow.
Changed everything.
That's great.
Absolutely everything. Couldn't work without it.
Right. What's the integration of the scanner with your practice management system?
Well, because we're on OrthoTrack, it's totally seamless. There are no bridges, no software bridges, there's no dongles. You plug it in and it goes. The hardest thing is to make sure that it's going to make money. If you're going to get into expensive technology, you have to be sure that it's going to generate income.
Right.
And the nice thing about using a 3600 scanner is it generates income at every level. It takes less time to take a scan than it does to take a set of impressions. It's much less traumatic for the patient. It's exportable to a number of third-party labs. For example, we don't make anything in-house anymore. Everything is exported to a third-party lab. And the day you take the scan, 5 minutes later, it's in the lab's hands.
Wow.
It's terrific.
Technology is an amazing thing in the
Yeah, it
dental
is.
space these days.
Yeah, it is.
Going around to the trade shows that we do, seeing all the various equipment and new technology out there, it's mind-blowing. And then in the next 10 years, it's going to be
Oh, it's only
completely
just beginning.
Right, exactly. So tell us about, tell our audience about 3 best practices that you use within your practice that you could share with them.
Well, the number one thing was, I hope there's no general dentist watching. The number one thing was to stop seeking general dental referrals and become a patient-centered practice. We've had a number, we're in the oil business in Calgary, so there's been ups and downs. And the most wonderful thing is when there's been a down because the oil prices are in the tank, our practice hasn't changed because it's all driven by patients, not by dentists. That was number one. The second would be to adopt an aesthetics-based diagnostic protocol. Nobody cares whether you get the overbite correct. Everybody cares if the aesthetics don't work out.
Right.
And so starting with that in mind is a good thing. The third aspect is employ appropriate levels of technology. Have an intraoral scanner. Have a cone beam machine. Those 2 things do everything. And our whole practice is based on digital imaging, either photography or cone beam scans or STL intraoral scans.
Right. That's where Carestream comes in.
That's where Carestream comes in.
So that's an interesting point of view on that you don't rely on the referrals from the GPs. So how does that change your marketing efforts within your practice?
Changes everything. We market to patients. So there's no more rubber chicken dinners with referring dentists. I go to referring dentists if I like them.
Right.
And that's really fun. And the rest of it we spend on our patients.
That's good. I think that it varies. I think doctor to doctor on their opinion with that. So that's
yes. We still need dental referrals.
Yes.
But we don't. You're not going to, in my opinion, you're not going to seduce them the way it was when I started in practice. When I started in practice, if you hung up a shingle and you took a dentist out for lunch, he was your referral forever. And that is not the case anymore.
Right. Times have changed,
They
definitely.
certainly have.
Definitely. So living in beautiful Canada, you actually live outside of Banff, which is,
Yes.
I don't know, for those of you who don't know, that's an amazing location in Canada. It's beautiful. Tell us about what do you like to do in your free time? I mean,
Well,
do you ski? Are you a big outdoors guy?
I ride a bike. I actually bought Lance Armstrong's 2009 tour bike.
Oh, that's cool.
Yeah,
Wow.
I've wrecked it twice now.
Oh,
But I ride a bike. That's what I do for enjoyment. But my real hobby is orthodontics.
right.
It's essentially all I do.
So you're a bit of a workaholic?
That's what my wife says.
Hopefully you get to spend a little bit of time with your family.
Yes, I do.
You can't be all work all the time.
No, you
I've
cannot.
learned this myself with my business.
No, you cannot.
Well, it was so nice chatting with you today and getting some insight into your practice, and we appreciate you so much in the orthodontic community, and I hope you'll write for Orthodontic Practice.
I will.
We would love that.
I will do that.
Okay, and come back again and see us?
I would love
On
to come
DocTalk?
back anytime
Okay.
you'd like.
All right, thanks so much.
You're welcome.
Take care.
Have a great day.
You too. Thanks so much for joining us today on this edition of DocTalk Dental. I'd sincerely like to thank our special guest, orthodontist Dr. Duncan Brown. And for more information on his practice, please go to smilezone.ca. And a huge thanks to our sponsor of this episode, Carestream Dental. For more information on Carestream Dental, you can go to their website online at carestreamdental.com. As always, for more info on everything ortho related, please go to orthopracticeus.com and subscribe to our publication. And check out doctalkdental.com to view this and other exciting episodes. Thanks again, everyone, for joining us, and I look forward to seeing you again on another edition of DocTalk Dental. See you very soon.